Good morning from Nigeria. My name is my name is Dr. John Oladejo. Using multidisciplinary approach and public emergency operation center concept in managing outbreak of Lassa fever in Ebonyi State, Nigeria, February 2018. This is the outline of my presentation. I have introduction, summary, so what, background, methods, results, conclusion, and future step. You can see the pictures of myself here and my colleagues where we were having public health emergency operation centers meeting regularly. And you can usually see me here, explaining what Lassa fever is all about to the community leaders in that particular local government where the study took place. By way of introduction, you can see the pictures of a mastermind residency, which is commonly known as multi-mammoth rat, which is the major culprit, is the vector that actually causes Lassa fever. So Lassa fever is an epidemic-prone disease with an alert threshold of a single suspected case and an epidemic threshold of a single confirmed case. So a confirmed case will show that there's an epidemic in that particular locality. So the disease was discovered in Lassa village in Borno State in Nigeria in 1969 when it was reported. Ever since then, outbreak of this disease have occurred in Nigeria, Liberia, Sierra Leone, Guinea, and Central African Republic. Human infections also exist in Democratic Republic of Congo, where we had Ebola recently, and then we have it in Mali and Senegal. The infection is endemic in West African countries and causes more than 100,000 to 500,000 cases annually, with about 5,000 deaths. So previously in 2012 and 2013, Nigeria recorded more than 2,900 Lassa fever cases across several states, and since early 2015 up to date, Lassa fever outbreak has been occurring frequently in Nigeria. Between 2015 and May 2016, the nation recorded one of the largest outbreaks of Lassa fever in its history. The pattern of the outbreak in 2017 is unique because it occurred all year round. Initially it used to occur during the dry season, but this time around it's all year round, all the season, and you find the usual seasonal life outbreak pattern. So in this instance, Lassa fever outbreak has often spread to affect healthcare workers within the health facility, resulting in several morbidity and mortality. So in summary, Lassa fever is a viral hemorrhagic fever and is a highly infectious and often fatal disease, and it always affecting the healthcare workers and with the following symptoms. You see here nose and throat during a surgical procedure. So the one that occurred in Ebonyi State was as a result of a procedure that was done in Federal Ebonyi State University Teaching Hospital in Abakaliki. So on the 15th of January 2018, the Nigeria Center for Disease Control deployed team to assist this Ebonyi State government in the outbreak investigation and response. So the aim of the response was to evaluate infection prevention and control in the university where cases were treated, and health workers' knowledge of IPC using IPC standard checklist at the facility and isolation virology center, and also to use public health emergency operation center in managing outbreak of Lassa fever, which was our major aim. So in this study, descriptive characterization of the outbreak in terms of person, place, and time was conducted, and state was assisted in establishing and activating public health emergency operation center, appointing state epidemiologists as incident manager, and also helping the state to formulate TOR for each pillar and that of IM support group. So why this investigation? This investigation was conducted to identify the source in order to establish control and institute measures that will prevent future episodes of the disease. Lassa fever is one of the epidemic-prone diseases in the country that's actually ravaging some part of the country, some part of the state in Nigeria. And it was also undertaken to train new personnel and to learn more about the disease and its mechanism for transmission. It was also as a result of severity of the disease affecting health workers, its potential for spread, the availability of resources, and sometimes by political consideration of the level of concern among the public, among the general public. So the background, let me quickly give us the background of this Lassa fever. Lassa fever is an acute, highly communicable viral hemorrhagic illness caused by Lassa virus and another virus. And I told you, I've already said that it was discovered in one of the villages in Nigeria, sometimes in 1969. It was characterized by fever, muscle ache, sore throat, cough, nausea, vomiting, chest, and abdominal pain, as well as bleeding from all the orifices, from the hair, from the nose, from the mouth, and so on. So primary host is the multi-mammoth, which I've already shown to us, and outbreak of the disease has occurred in Ebonyi State, Nigeria. So the methods adopted for this investigation, the first thing was to institute active case search and contact tracing in all the LGAs with confirmed cases. Like listed all suspected and confirmed cases of Lassa fever, descriptive characterization of the outbreak in terms of person, place, and time. We were able to establish and activate public health emergency operation center in the state, appointing state epidemiologists as the incident manager, and then formulated term of reference for each pillar and that of IF support group. Then the constitutional studies carried out was to assess the facility of the IPC status, as well as knowledge, attitude, and practice of the healthcare workers in Ebonyi State Teaching Hospital. Data obtained enter into a computer database, cleaned and analyzed using PHEOC software version 7.0. So this is the IMS structures adopted in managing the outbreak of Lassa fever in Ebonyi State. You can see we have the incident manager, we have the surveillance and epidemiology, and we have a pillar head. So this is a multi-partner membership in all the thematic areas. And we have bi-weekly meetings, we have the situational report, then we have action trackers and follow up for the task completion. So this has actually helped us to be able to contain the outbreak. And this is the result. If you see the epidemic curve of Lassa fever in the Ebonyi State, if you look at it critically well, the Lassa fever confirmation was on the 14th of January 2018, and then immediately we moved in from our office in Abuja to Ebonyi State. And you realize that immediately we moved in and then we started the response activity, the outbreak started subsiding to the extent that within a very short period we are recording 0 cases. So you can see that the red is the death and the blue are the cases. And started on the 28th of 28 December 2017 in a sporadic manner, that it was not becoming a serious case until 14th of January 2018, and we move in immediately on the 15th, and then by 20th of January the cases have started subsiding. So these cases of suspected and confirmed Lassa fever cases in Ebonyi State. You can see in Abakaliki we have the highest number of cases, and in Ohozara we have the lowest number of cases. This is the Lassa fever cases by occupation as at 26 January 2018. You can see that doctors were mostly affected, then followed by the admin deaths. Then we have the non-health workers. Then we have the nurses, which is about 4%, and then we have lab scientists, which is 5%. This is the health worker knowledge about Lassa fever epidemiology and precautionary measures in dealing with infected patients. So you see, we have some variables, and then we have frequency and percentage. From here, you can see that the knowledge about Lassa fever epidemiology good, and the frequency is about 63, and percentage was about 46.7%. And for our fair is 60, our poor is 12, and the percentage is 8.9. From all this, we realize that the frequency for the good knowledge in dealing with the infected patient is 112, which is about 83%, and that of poor is 1, which is 0.7. So under our discussion, the Lassa fever is endemic in Ebonyi State with several severe outbreaks, regarding that claiming in most cases the lives of health workers. This present outbreak was active in Ebonyi with at least one confirmed case. However, since local government have reported both suspected and confirmed cases, these are Abakaliki, we have 16, Afikpo 1, Eza North 1, EC 2, and Ozara 1. So at our 26th of January 2018, there were 22 suspected through confirmed cases and 7 deaths. 8 cases were confirmed and 2 probable cases, 3 confirmed health workers were reported dead. And that was our concern. We don't want all our health workers to be dying, so that we need to intensify effort on IPC. So contact tracing was done, and about 150% were in the contact list. Then the social demographic characteristics show that the age group mostly affected was 20 to 40 years. Health workers were mostly affected. Among the health workers, doctors were affected most. In all, the male were more affected than female, with a ratio of 2.6 to 1. So the case fatality rates were very high, which is unacceptable, and that was the reason why we really needed to put more effort, to ensure that at least the cases were attended to with immediate effect. So total number of deaths among all cases was 7, with 6 deaths among confirmed and probable. So the cause fatality rate was 31.8% and 60% respectively. So the practice of IPC at FETA was low as reviewed by the IPC assessment, which we did. However, the knowledge of Lassa fever was high among the health workers. They have the knowledge of what Lassa fever is all about and how it is being spread. The facility assessment showed gaps in the provision of infrastructure, holding areas for suspected cases were and waste management. There was a lot of supplies of PPE from the federal to the state, and even the state they were able to procure more of the PPE. The coordination of activities during the outbreak was poor initially. It was when we now came in that we now put up all this EOC, as Public Emergency Operation Center, which enabled us to have a full response of the outbreak, and were able to manage the outbreak within the very short period. So a total of 537 samples were collected and sent to a specialist hospital called the Rural Specialist Hospital. We and WHO, that is what the organization team, supported the state in response with daily review of the meetings, plans, and mentorship of the people in the teaching hospital. So, in conclusion, sir, ladies and gentlemen, IPC knowledge, practice, and availability of PPE are generally low among the healthcare workers, and that might have been the reason why most of the health workers were being affected, because they didn't have enough PPE at the time we were getting there. So sensitization and training among health workers and mentorship were carried out to reduce healthcare workers' vulnerability to the infection, to the infection in the nearest future. So it was also documented that number of new cases declined as Lassa fever EOC was established and immediately activated. So for our future steps, additional steps of the social factors and effect of risk communication in preventing and controlling outbreak of Lassa fever should be done immediately. The development of viable vaccines. We now have technical working group that are working on the development of the viable vaccines, and within the next few weeks or a couple of days, we are going to have the first ever Lassa fever international conference, and you can Google it. You can all the people that are here seated can be part of it, or people that are hearing me. So it's an avenue for us to showcase what Lassa Fever has been doing, and then be able to know what we have done in mitigating it, and what we are going to do in making sure that we making sure that we eradicate Lassa fever on the surface of the earth. So, active site in the pharmaceutical drug with minimal side effects is another thing, because ribavirin is the only potent drug we are using, and you have to use it. You have to make sure that you infect it immediately. If not, the patient may eventually die. So, with all this, I think I've done justice to my topic, and these are my references. I have to thank NCDC for giving me the opportunity to lead the team to Ebonyi State, and I have to thank Texila for giving me the opportunity to present and to showcase the work we have been doing. So these are the references. We have done some work before. These are the part of the work we are doing. So thank you and God bless.
Continue this Q&A session. We have a polling session also for this presentation. So dear participants, please, we are now in a Q&A session. I request the participants to pose the questions if you have any questions to ask Mr. John directly, so we can able to answer the questions.
Yeah, I have a question here from Maka.
Yes.
Yeah, is there any policy to control the outbreak? Yes. In Nigeria Center for Disease Control, we have what we call SOP. SOP is Standard Operating Procedure. We have different protocols in controlling and managing the outbreak. So these are the documents we use in ensuring that if there's any outbreak in any part of the country, we are using to actually manage the outbreak. So there is policy, there is document, there's guidelines. We have guidelines on surveillance and epidemiology. We have that we need to follow to be able to control the outbreak effectively. We have guidelines on the drug management, case management. We have guidelines on laboratory procedure. We have guidelines even in coordination. You can't just say you want to coordinate if you have not been trained. And we have different type of training. I have actually I was trained in the CDC Atlanta on public health emergency management, and I'm a fellow of it. And all the system of managing this outbreak are being used, and that is the reason why we are not getting good results. Thank you. Another question from Muhammad Ibrahim.
From Muhammad Ibrahim. Did you relate your study with existing literature to see how your study compares? This is a posed question by Mr. Muhammad Ibrahim.
Okay, thank you, John. Could you relate your study with existing literature to see how your study compares? Yeah, if you look at some of the literatures I actually used, we realized that using public health emergency operation center have not been in the vogue before. You know, so it's been introduced into the country, and we had the first set to have used public health emergency operation center in managing the outbreak. So to really compare, you can only compare with people that just go to the field, manage the outbreak and come back, without necessarily referring to public health emergency operation center. So we are the first set, although we have it in other countries, like the US and some other advanced countries. But for Nigeria, this is the first time we are using EOC to actually manage the outbreak. Thank you. Thank you, John. Please, what is the current prevalence?
John,
of
what is the
yes
of Ebola virus infection in Nigeria?
In Nigeria now, the current prevalence is 23.1, but with the new system we are doing, it will reduce drastically because we continue to monitor the outbreak. We continue to monitor the all our states that are actually being infected with Lassa fever. So within a very short period, we are at 60% before, but now we are getting to 23%. And before you know it, Lassa fever will be a thing of the past. By the time we now get a vaccine that is viable enough. So I'm imploring you to come to our conference on the 16th and 17th of January 2019 at Nikon at Transcorp Hotel in Abuja, where we are going to showcase most of the work we have done on Lassa fever. Another question. Okay, did you find any similarities of health workers' knowledge with regards to other hemorrhagic fever? So actually, we didn't go into that, and that is one of the things we would like to do as soon as possible. You know, we are actually not having enough funds to stay longer, and then to be able to, do such. But we're going to work on that, and we are going to do our presentation in the next e-conference of Texila. Thank you for the presentation. Did you find any other question? Oh, are the developed policy universal? No, the developed policies are just for usage in Nigeria. We develop it to suit the Nigerian purpose, to suit our health policy, not universal. But people can go to our website and copy it and try and use it and see whether it works for them too. Anybody from any country can do that. Hi, everybody.
Mr. John, we have one more question from Fred.
Okay.
How structure link the community in the control of Lassa? How did
okay, Mr. Okay. Well done, John. How did your structure link the community to the control of Lassa fever? Thank you very much. We have a pillar called social mobilization stroke risk communication. This pillar, their own work is to tailor the message to the community where the outbreak is actually occurring, and we are able to link them to what we are doing at the at the state level as well as the local government level. So we have a very good linkage, and you are all you can see one of the pictures I show where I personally even went to the village to talk to them about what Lassa fever is all about. So we don't have problem in linking with the community. Which other question again? Now, if they spread to other countries and the policy apply, yes, we can apply the policy because the policy has been tested in Nigeria and is working fine. So if they apply it to either Senegal, Mali, or any of the countries that have Lassa fever, it will work. All what we need to do is that the people there will have to be trained on on Lassa fever management, outbreak management. They have to be trained on IPC, infection prevention and control. They have to be trained on IMS, that is incident management system. That's all we needed to know, and they apply the policy, and they are fine. Thanks for the presentation.
Thank you, Mr. John. It was a wonderful Q&A session. Thank you for reacting. TWCers, Texila's 5th AIM Conference, World Conference for All.
Okay, thank you. Thank you. God bless.
Dear participants, please poll for Mr. John Oladejo for her presentation done on the title of Using Multi-Disciplinary Approach and PHEOC Concept in Managing Outbreaks of Lassa Fever in Ebonyi State, Nigeria. Your poll will be very valuable for Mr. John Oladejo for his presentation. So active participants, very thank you for your polling here, and we'll end the poll here.